therapy can be broadly defined as the transfer of genetic material to cure a disease or at least to improve the clinical status of a patient. One of the basic concepts of gene therapy is to transform viruses into genetic shuttles, which will deliver the gene of interest into the target cells. A pleasant day, everyone. I'm Hashel Oroyan Kilay from BSED 2 Block 1, and today I'll be expanding the basic process of genetic therapy. So without any further ado, let's begin. First, creating a working gene. The gene transfer therapy process begins when a working or functional gene is created in the laboratory. The working gene is developed to contain the instructions for making a needed protein. Scientists design working genes to meet specific needs. For example, in patients with hemophilia A, the F8 gene is needed to code for the factor 8 protein, which is essential for clothing. And in hemophilia B, an F9 gene is needed to code for the factor 4 protein. Second steps on the process. Building a therapeutic vector. The working gene now has to be delivered into the body. It needs to be protected and directed on where to go. To do so, a therapeutic vector is used. This therapeutic vector is created by modifying a naturally occurring virus. The shell of the virus is created without the viral DNA, and the working gene is put inside the empty shell. No longer a virus. The therapeutic vector is designed to deliver the working gene to the cell in the body where it is needed. Third step, determining eligibility. As part of gene therapy research, a healthcare provider must determine whether a patient is eligible. Factors such as age, gender, and organ health may be considered. Fourth step, delivering the working gene. Once the patient is determined to be eligible, the gene therapy is ready for administration to evaluate its safety and impact. A single one-time infusion in an appropriate clinical setting delivers large numbers of therapeutic vectors into the body. The therapeutic vector is designed to both protect and guide the working gene toward preferred cells where it can be used to make the needed protein. Research is ongoing to determine the possible impact of the therapeutic vector delivering the working gene to other cells in the body. Once in the body, the new gene is designed to do the work of the gene that is missing or isn't functioning properly. The goal is to provide instructions for the body to make the protein it needs on its own. And ongoing research is evaluating the risk and impact of introducing the new gene. Fifth and last on the process, monitoring safety and efficiency. Regular monitoring after gene therapy is important because it allows researchers to understand any risk and what impact the gene transfer is having. Patients in clinical trials meet with their care teams for blood tests and to discuss their medication regimen and lifestyle to collect data as part of the study. As with all medications, response to gene therapy may vary. How long gene therapy might keep working is being evaluated in ongoing clinical trials with researchers aiming to create a long-lasting therapy. To sum up my discussion for today, I agree that gene therapy is designed to introduce genetic material into cells to compensate for abnormal genes or to make a beneficial protein. If a mutated gene causes a necessary protein to be faulty or missing, gene therapy may be able to introduce a normal copy of the gene to restore the function of the protein. Thank you everyone and have a blessed day.